My Ace Boon Coons, what is up? Today is Wednesday, December 11th, 2024, and we're going to talk about healthcare. Go figure, huh? Maybe this might be Bayer Drugs Part 3, Bayer Drugs Monsanto Part 3. Anyway, I'm finding it fascinating how people are coming together. Anytime people come together, I find it most fascinating. And go figure. This assassination of the United Healthcare CEO has definitely started a debate, but bringing people collectively together, opening up their eyes to the corrupt healthcare system. So we're going to set it off like this. Some fun facts.
Because more than 26,000 Americans die each year because of the lack of health insurance. More than twice as many as were murdered. And that alone can give you at least a starting point, right? United Health Group, which is the parent company of United Healthcare, is the 8th biggest company in the world by revenues. And infamously, they say that, with great power comes great responsibility. Except that
Check out the numbers. Numbers don't lie, they say.
16% of insurance claims are rejected in the healthcare space. For United Healthcare, it's 32%, meaning that around 1 in 3 paying customers has their claim rejected. This just scratches the surface, and we can go a little bit deeper and find out a little bit more. Given that the insurance industry rejects claims at such a high rate, you would expect some of those savings to maybe have been passed on to the consumer. And so I decided to check, how have insurance deductibles and premiums changed over time relative to wages and inflation more broadly? And the answer was not well. Between 2010 and 2020, the cost of deductibles has more than doubled. And the cost of family premiums, the monthly payments, increased by over 55%.
Wow.
And today, low-income families spend close to a third of their income on health insurance premiums. It's not good. Just showing you numbers doesn't really capture the full picture, because sometimes it can be easy to get lost in the numbers and to understand how this actually translates into human impact. And ProPublica just last month published an amazing article about United Healthcare's playbook when it comes to mental health coverage. And this will really help you understand how all of these numbers actually translated into human impact over the years. United Health Group, the parent company, has seen their revenue grow by over 47 billion in the space of a year. And to achieve such massive growth in an industry like healthcare, you need to rely on the same playbook that other industries have relied on, which is optimization through technology. United Healthcare implements an algorithm called ALERT, Algorithms for Effective Report and Treatment, to determine whether or not a person undergoing mental health treatment has had too much therapy. If a therapist passes an arbitrary threshold, they get contacted by what's called a care advocate, who will call them and grill them for providing too much care to their patients. The official term for this is the risk of overutilization of routine outpatient services. What this looks like in practice is pretty crazy, I think. I want to give you a testimony from a patient who had their claim for mental health treatment denied. She says that 2 years ago, my therapist was denied payment for 7 of my mental health sessions she provided. I tried to pay her even though I'm on a limited income, and she wouldn't take the money. If my provider, in her professional opinion, believed I needed those therapy sessions, who is United Health to deny coverage? And if you're curious about what too much therapy actually looks like, it is 30 sessions in 8 months. This was the threshold for initial flagging, which...
So this is wild. I mean, the future of AI is straight up demonic, dude. So even United Healthcare has got an AI system that I don't know if it's implemented yet, but it's going to deny or approve people's cases. So we're going to have robots, dude, reading this algorithm according to your charts, or I don't know how they're going to do it, but dude, I don't know. This is going to be very interesting. This is going to start making a lot more sense to you guys. All right, so here is Mr. Whitty, Andrew Whitty, the actual United Healthcare CEO. Now, they have many branches, I'm assuming. But this was 7 months ago at a hearing at Congress, and Andrew Whitty is blasted. Watch this.
Thank you, Mr. Chairman. So, Mr. Whitty, in 2023, United Health raked in a whopping $22 billion in profits. making you the most profitable healthcare company in the country. In fact, by revenue, United Health is the 11th largest company in the entire world. Now, Mr. Whitty, United Health Group owns the country's largest insurer, the country's largest claims processor, the country's third largest pharmacy benefit manager, a huge pharmacy chain. It is the largest employer of physicians nationwide, or controller, with at least 90,000 physicians, as you just testified. That's about 1 out of every 10 doctors in the country. Is that correct about your size?
So just to thank you, Senator. As far as the physicians are concerned, we employ just under 10,000,
Well,
and
as
the
I
rest
said,
are
I think you have
affiliated.
control over about 90,000.
I would say not control. They choose to work with us.
Okay. Great. Because United Health has bought up every link in the healthcare chain, you are now in a position to jack up prices, squeeze competitors, hide revenues, and pressure doctors to put profits ahead of patients. United Health is a monopoly on steroids. The opportunities for price gouging are everywhere. For example, United Health is the biggest participant in Medicare Advantage, the government program that pays private insurers to administer Medicare benefits. With this web of subsidiaries, United Health is well positioned to rake in more taxpayer money by using a practice called upcoding to make enrollees look sicker. That is, noticing that a patient has a cane and adding a diagnosis of vascular disease to the medical chart, even if there's no clinical basis for the diagnosis and no treatment planned. Mr. Whitty, according to a 2019 investigation by the HHS Inspector General, United Health was far and away the most aggressive abuser of upcoding practices. Do you know how much, according to the Inspector General, United Health cheated taxpayers out of in 2017?
Senator, thank you for the question. I'm not familiar with that particular piece of work.
Yeah, the number is $3.7 billion, and that's in just a single year, and that's from only 2 upcoding practices. You know, that was 5 years ago. Now, as we speak, is United Health under investigation from the DOJ for, among other things, your billing practices?
Senator, thank you for your question. We have a long-standing practice of not commenting on matters such as that or things like mergers and acquisitions.
Well, I understand why you might not want to comment on it. Public reporting from the Wall Street Journal confirms that it is, although your company has not disclosed this investigation. In fact, yesterday I sent the SEC a letter raising concerns about over $100 million in stock sales that United Health executives made in the days and weeks before the investigation was revealed by the press. And I'd like to make that part of the hearing record if I can, Mr. Chairman.
Objection, sword.
Okay, so United Health is huge, and it boosts its multi-billion-dollar profits with, among other things, illegal billing tactics. And that takes me to the data breach. After the largest cyber attack on the healthcare industry in American history, quote, put hundreds of thousands of healthcare providers at risk of collapse, United Health is now using the crisis to expand its monopoly even further. For example, in Oregon, United Health tried to purchase a local physician practice, but faced enormous public opposition. After the data breach that we're talking about today, these doctors couldn't get reimbursed for their services, which pushes them to the financial breach. So what did United Health do? They filed an emergency petition with regulators to allow them to acquire the doctor's practice on an expedited basis. Mr. Whitty, will this acquisition make United Health even bigger?
Senator, thank you for your question. I'd just like to also put on the record that we, as an
I
organization...
had a very simple question. Will it make United Health, this giant, this 11th largest company in the entire world, even bigger?
As new organizations join us, the organization, I hope, becomes better as new physicians, for example, join.
The question is not better. We've already talked about your business practices. The question is bigger. Will it make United Health bigger?
As we grow, we become larger, yes.
Yeah, okay. So,
that
you
an
know,
AI?
United Health is using its own data breach to snap up doctors' practices that have been driven to the edge of bankruptcy by that same data breach. It's no wonder that United Health told its shareholders that this data breach would have, quote, no material impact on the company's finances. United Health will stop at nothing to grow bigger, bigger, and bigger as we speak. United Health is trying to pick the bones of Stewart Health Care in my home state of Massachusetts, which was ruined by.
All right. That is from the Senator Elizabeth Warren's page. Remember Elizabeth Warren, Pocahontas? Well, cheers to you for pressing Mr. Andrew Whitty, CEO of United Healthcare. Press him some more. Ooh, that case is about to open back up. All right, let's finish up. Let's see what else she says.
Private equity and corporate greed. It is time for regulators to say no to these efforts to get bigger and to suck even more health dollars away from patients and providers who need it. For the sake of our patients, our doctors and nurses, and the American taxpayer, it is time to break up the United Health
The
monopoly.
time of my colleague has
Break it up.
expired. Next in
Break it up. Now, this was a year ago. So, a year ago, Mr. Andrew Whitty was really, really busy. Let's see what we learned about the healthcare system and how they abuse the Medicaid system, which is our government healthcare system. Now, these guys are getting rich off of our taxpayers. Our Medicaid comes out of our checks, your checks, and it's dumped into a big Medicaid pot, which then the healthcare providers like United Healthcare dip out of, charge, and get rich from. Meanwhile, denying some of your healthcare coverage that you so desperately need. Let's see what let's let her explain it a little better.
By exploiting the government's Medicare Advantage program. A recent New York Times investigation found that 8 out of 10 of the largest Medicare Advantage providers overcharged the government. In fact, 6 of the 10 have been accused of fraud by both whistleblowers and government officials. Before the Biden administration could implement any rules to mitigate or prevent this fraud, private health insurance lobbyists did what they do best. They went to work. They went to Washington. United Health helped lead an aggressive lobbying campaign against new Biden administration rules aimed at limiting Medicare Advantage insurers' ability to overcharge the federal government by making patients appear sicker than they actually are. United Health CEO Andrew Whitty appeared on Capitol Hill in person to lobby against the proposed changes, which the lucrative Medicare Advantage industry falsely characterized as cuts to the program that now provides insurance to nearly half of the overall Medicare population. When it comes to excess billing, CMS, which by the way agreed to slow down their regulations and their crackdowns on overbilling, recently estimated that overpayments to Medicare Advantage totaled $11.4 billion in fiscal year 2022, a significant drain on the Medicare trust fund. Other estimates, according to Democracy Now!, were higher at $25 billion in 2020 alone. Citing one industry analyst, Stat News noted that United Health could reap $900 million in additional profit next year alone, thanks to the administration's decision to delay full implementation of reforms. Insurance giants, United Health, Cigna, CVS Aetna, Elevance, Humana, you get the picture, and Molina saw their combined revenues from taxpayer-supported programs grow 500% between 2012 and 2022. United Health is one of just 7 large for-profit insurance companies that now control 70% of the Medicare Advantage market, which is dependent on taxpayer money, our taxpayer money. taxpayer money that they steal by overbilling their patients, by overcharging and overbilling the Medicare trust. So it's incredible to me that on one hand, you have Republican lawmakers pretending to be panicked about the solvency of various social safety net programs, whether it be Social Security or in this case, the Medicare trust. Shouldn't we do something about the private companies that are defrauding the system? Shouldn't we crack down on that? And by the way, the Biden administration aiding and abetting the robbery in the first place, it's pretty disgusting. Like, what is he gonna do? Is he gonna blame Trump for that too? This is happening under his watch. The Biden administration is fully aware of what these private insurers are doing in stealing money through overbilling. And they're letting it happen. They're slowing down the implementation of these rules that are meant to crack down on this terrible behavior in the first place. Just something to keep in mind when the Democratic Party pretends to be better than Republicans. Because fact of the matter is, the whole corrupt political system that we're currently living under does not discriminate against Democrats. The money flows into the coffers of Democratic lawmakers and Democratic politicians as well. So just like Republicans, they do the bidding of corporate America. And in this particular case, they do the bidding of private insurance companies that are literally stealing money from the Medicare trust, a trust that we all pay into.
Thanks for watching The Young Turks.
Fair. Now that was fair. Fair journalism. There you go. The Young Turks. Keep up the good work. I know you guys could be pretty biased sometimes, but that was not. That was fair. Let's go. We got more. This gets juicy, dude. I'm not saying what happened was a good thing to the United Healthcare. Yeah, don't go around killing people, obviously, but damn, was it not one of the biggest eye openers of this year, dude? This is from 2 years ago. No one was paying any attention to this, but it's been going on for decades, dude. Listen.
This is Democracy Now! I'm Amy Goodman with Juan Gonzalez. A major investigation by the New York Times this weekend has found many of the nation's largest health insurance companies have made billions of dollars in profits by exploiting the government's Medicare Advantage program. 8 of the 10 largest Medicare Advantage providers have overbilled the government. 6 of the 10 have been accused of fraud by the government or company whistleblowers. This comes as the number of people enrolled in the privatized system continue to grow. Projections show that by next year, more than half of all Medicare beneficiaries will be enrolled in a private plan. Under the system, health insurers get more government funding for sicker patients, which has given the companies an incentive to make patients appear more ill than they actually are. United Health, Humana, Kaiser, and other health insurance companies have been sued for fraud for overdiagnosing patients to bump up profits. The cost to taxpayers is staggering. Overbilling by health insurance costs the government an estimated $12 to $25 billion in 2020. The New York Times reports doctors at Kaiser were offered bottles of champagne and bonuses if they added additional illnesses to the medical records of their patients so the company could make more money. Joining us now is Wendell Potter, former executive for the health insurance companies Cigna and Humana. Potter is now the president of the Center for Health and Democracy and the president of Business Leaders for Healthcare Transformation. He's author of the book Deadly Spin. An insurance company insider speaks out on how corporate PR is killing healthcare and deceiving Americans. Welcome back to Democracy Now! Wendell, joining us from Philadelphia. If you can start off by explaining how Medicare Advantage works. Many people might say, oh, they thought that was a government program for people 65 and older.
Yeah, it's important to note that it is neither Medicare nor is it an advantage. It is, I think, will be recognized in years to come as probably the biggest heist, the biggest fraud, the biggest transfer of wealth from taxpayers, middle income, low income Americans, from them to corporate executives and shareholders. It is a plan that has been in the works or has been around for about 20 years. It was born during the George W. Bush administration when Republicans controlled Congress and they were determined to start privatizing the Medicare program. And as you noted, now, 20 years later, is to the point that almost half, and in some cities and districts, well more than half already are enrolled in this program. It is a private program. It is operated by private insurance companies. Most of them are for-profit. In fact, this year, over 80% of the enrollment in these plans were people enrolling in for-profit plans. They're lured into these plans with deceptive advertising. The plans feature things that are common in private plans but not in traditional Medicare, such as prior authorization. Doctors have to get permission in many cases from the insurance company before they can treat their patients. Inadequate networks, particularly as people get older and sicker, and very, very high out-of-pocket cost if people knowingly or inadvertently go out of network. So it is a program that absolutely should be called disadvantage.
And Wendell Potter, it's to me, it's amazing. The healthcare system in this country right now, when you go to a general practitioner, they basically are constantly referring you to specialists who always then want to do more tests, and it's the testing process of all of these specialists that drive up these costs. And as you say, on television, almost every single night, there are ads trying to lure senior citizens into these Medicare Advantage programs, this privatization of Medicare. Why?
100%. Not to mention the spam calls that you and I are getting. I don't know about you, but I get at least 30 healthcare provider spam calls a day. At least 30, at least, I swear. Now, hopefully something is done about that. Now that we know it's a scam. You know, it's a heist, literally a heist on our taxpayer dollars. They're lying about our illnesses just to get more profit. You want to know some more? Let's go.
Why isn't the government exercising more regulation or control over this process, especially the one that, as the Times reported, piling on imagined or badly documented illnesses?
Maybe I can answer that. Because recently I've learned that, like you heard in the last Young Turks video, Republicans and Democrats are both guilty of allowing this to happen. You know, we have oversight for this, but their backs are turned. They turned the other way once the lobbyists, like these big names, like the Andrew Whitty guy, the CEO of Healthcare, United Healthcare, comes in and gives them a big ass check, a donation for their party or for their election or for their campaign. I'm talking about billions of dollars. So of course it doesn't matter. They figured out, the healthcare system figured out, if we pay both of these parties, then we'll be all right. There's no losing. It's a win-win. We'll pay both Democratic parties and Republican parties. We'll help their agendas and they'll help ours. Easy as that. Genius move, but you've just been exposed.
Journalism. So they've known this, but they've turned a blind eye in many cases because of the massive amounts of our money that these big corporations are spending to lobby Congress, to throw money into their campaigns for re-election, and to propaganda campaigns, and very, very misleading advertising, as you just mentioned. Open enrollment will begin in just a few weeks for Medicare-eligible beneficiaries, and you will see just a barrage, a constant barrage of ads from these companies that they do not tell the truth. They leave out important details, like some that I mentioned earlier. So that's how they pull it off.
So yeah, there you go. It's a win-win. Both parties get some cash and then turn the other way. We have oversight. All right, I'm going to leave you with this. This is what everyone should know and be aware of. Here we go.
This is something that every senior should know. These companies go after people when they're younger and healthier with kind of a siren call that you can enroll in these plans for no money. You can actually get money put back into your Social Security account, as we hear from people like Joe Namath and William Shatner and Jimmy J.J. Walker. But the truth is, as you get older and sicker, then you become aware of just the disadvantages of this program. My mother broke her hip. She needed to have rehab and skilled nursing services for a while. When we looked at what was available to her in the provider network, it was incredibly inadequate. So I worked with my mom to get her out of a Medicare Advantage plan. It was one that was operated by United Healthcare, and they market in conjunction with AARP, which is an outrage in my view. But there's a problem there, because when you do that and you're older and you wait, years after becoming eligible for Medicare, it's harder and more expensive to get a Medicare supplement policy to help cover your out-of-pockets. So we did that knowing that. We had to pay a lot of money, but at least she was able to get the care that she needed at a quality facility where she got the rehab and skilled nursing care that she needed, which she would not have gotten had she stayed in that Medicare Advantage program. I'm confident my mom lived additional years because of what we were able to do.
Wendell Potter, finally.
All right. Hey, there'll be a part 2 or 3. I don't even know. This could go on and on. Love you guys. I'm going to leave you with that. God bless you. Talk to you soon. Stay educated.